Looking for financial insights you can trust?
How do you protect yourself as an investor? What's the strategy?
I think it's really simple. I think you just want to be diversified in your portfolio.
The Payne family brings real-world experience to every conversation.
Well, I think that's the problem right now is, right, a lot of people that are close to retirement, they're taking so much risks. And if we do get a big sell-off, it could derail their retirement.
Listen to the Pain Points of Wealth on the Red Apple Podcast Network.
This episode is brought to you by Nature's Bounty. Nature's Bounty believes your body is brilliant, naturally designed to thrive, inside and out. For those always looking for new ways to support your health from head to heels, Nature's Bounty has a range of over 400 vitamins and supplements born from 50 years of trust and care. Nature's Bounty. It's in your nature. Visit naturesbounty.com to learn more.
Sunday morning with us, Dr. Peter Michalos, and Live Long and Prosper is his nickname. Well, Dr. Peter, what are we going to do to live longer?
Well, one of the things we want to do to live longer is we definitely want to avoid getting things like the flu and COVID. And as we're approaching, the peak is December and January. And we have to remember that on the average in the United States, 35,000 people a year die from flu, and worldwide, 700,000 people die a year from flu. So it is something to be concerned about. And the CDC reports that there's a new flu variant called the K variant, and it's from the flu A family. And the flu A family, compared to the flu B, is actually the one with worse symptoms. So if you have fever, cough, sore throat, congestion, body aches, headaches, fatigue, the best thing to do is to get tested, because these viruses replicate. And if you can get oral antivirals like Tamiflu, if you have the flu, within the first 72 hours, it makes a big difference to block bioreplication and reduce the symptoms, and then you're less likely to end up in the hospital or end up with secondary pneumonia. Of course, flu vaccines are always helpful because they soften the blow with some cross protection, even if they didn't make the vaccine for that specific strain. So these are the things. The other interesting thing that people always talk about, vitamin C and flu. Vitamin C doesn't help prevent you from getting it, but what it does is they've shown it helps reduce the symptoms. So it's a good thing. It's a good thing to have. And then turning to our other friend, COVID. COVID strain is called the Stratus strain, or the XFG, which is now the dominant 76% of cases. And then there's another variant that represents the other cases called the Nimbus variant. And the good news is that there is now a non-mRNA vaccine option, because a lot of people just want the traditional protein cell vaccine, the same type that we have for hepatitis, shingles, and diphtheria, tetanus, and pertussis, which already exists. So now there is that option. It's called the Novavax, and you can ask your doctor for it. So if you, because some people have concerns about how much testing was done in long-term from the mRNA vaccines, and what they do is they just take basically the dead inactive spike from COVID, and then they make antibodies, and they add something from nature called something from the soap bark tree, which actually is an adjuvant, which means it helps stimulate the immune system to go after the viruses. So that option does exist, which is a good thing. And the other thing with COVID, of course, we do have the 2 antivirals now, which really makes a big difference, but you must get it within 5 days of getting symptoms. And there's Paxlovid, which has some side effects and interacts with more medication. And then the other option is the molnupiravir, which has no drug interactions, but you can't take it if you're pregnant. And if you take it within 5 days, you lessen the symptoms, less likely to end up in the hospital. And of course, as we've talked about in WABC, the better your D levels, the less severity of COVID-19 you get. And basically also they found on blood tests, the higher your D levels were when you got COVID, the lower the inflammatory markers, because vitamin D has been shown to also enhance your whole antimicrobial defense system. So it builds up your armor, and it's like your shield. And which is
none of the doctors I go to ever run a vitamin D test unless you specifically ask them. None of them run a arsenic test or a mercury test unless you specifically ask them. Is there a reason for that?
Yes, because they're employee physicians of a health system. So if you're part of a certain health system and you do the test and then the insurance company doesn't pay for it, then the hospital doesn't get paid for it, and those doctors who are employees get penalized. If you go to an independent, concierge or integrative medicine specialist, they're not thinking about the numbers. They're thinking about what can I do to help this patient. So doctors have only 15 minutes to see people, and they just do the bare minimum amount that's required for them for risk management. But they're not going to go and measure other things like, for example, COVID-19 patients are found to have deficiencies in selenium, magnesium, vitamin A, and nobody's going to do those tests, or they're not going to tell you that, that when you have COVID, you have low glutathione levels, take some glutathione. They'll only tell them what's in the most basic standard of care. And also when you order those tests, you have to supply and fill out a lot more paperwork and diagnosis codes. Each test, if you don't have the diagnosis codes, the insurance company won't pay it, and it creates a multi-level, uncompensated administrative burdens, and they have to fill out forms. So that's why we need a transparent healthcare system where you have a price list, and that's why the good thing now is if you can go to the major labs, you can go buy your tests on your own and get a package. For example, you can pay $200 for a hormone package, whereas if you did it in the hospital, it would be $1,000. Same thing with x-rays, as we know, MRIs and CAT scans. If you go to the hospital, it might be $2,000. If you go to a private center, it'll only be $500. So it has a lot to do with the paperwork and penalizing doctors who are employees who no longer have control of their own practices. But the last thing I just want to quickly touch upon is the electronic heroin of cell phones that we talk about on WABC, warning parents. And it's now been confirmed that people who get cell phones before age 12 have 1.3 times more depression, 1.6 times more insomnia, 1.4 times more obesity. And when they're on social media all the time, it's also creating a problem with the envy and jealousy, and everyone always posts their Instagram picture of the perfect moment in life. And these young kids, who some of them won't have the opportunity to do or see or eat some of these foods, you see teenagers taking pictures in their restaurants. So it creates a feeling of inadequacy and depression. So that's why it's important to keep the cell phones away. For communication, they're good. Just get a regular flip phone that doesn't go on the internet so you can communicate with your child, with school, and these are some of the solutions. But we're learning more that cell phones are toxic, and that's why a lot of school systems are requiring them to hand it in the beginning of school and then hand them back at the end of school.
Well, it is what it is. Well, Dr. Peter Michalos, thank you for everything you do to make our listeners live longer, and God bless you and God bless America.
Thank you, John. Health is wealth, and thanks for always getting the truth out on the Cats Roundtable.
Looking for financial insights you can trust?
How do you protect yourself as an investor? What's the strategy?
I think it's really simple. I think you just want to be diversified in your portfolio.
The Payne family brings real-world experience to every conversation.
Well, I think that's the problem right now is, right, a lot of people that are close to retirement, they're taking so much risks. And if we do get a big sell-off, it could derail their retirement.
Listen to the Payne Points of Wealth on the Red Apple Podcast Network.